A very good morning to one and all. Today we are moving to the next topic, that is upper respiratory tract infections. It is of around five conditions are there: rhinitis, sinusitis, tonsillitis, pharyngitis, and laryngitis. So today I'm going to discuss with first one, that is rhinitis and its management. I think you people are a little bit familiar with the rhinitis. Some of the times you people are also complaining of this rhinitis, or some of you suffer from this rhinitis. It is nothing. It is otherwise we can call it as cold. So almost times when the weather is changing or after a rainy time, during the rainy time, usually some of you can affect with this condition that is called, we can call it as rhinitis. Okay. So let me introduce the topic. Rhinitis is an inflammation of the nasal mucosal layer. First of all, that is also the definition I'll discuss later. So rhinitis means that is an inflammation which is occurring on the mucus layer. In the when we are discussing the anatomy and physiology, I already told you our mucus or our nasal tract and respiratory tract and all lined with the mucous membrane. And this mucous membrane, whenever it is getting loosened, that time this rhinitis is occurring. Allergic rhinitis or hay fever is initiated by hypersensitivity reaction to one of a large group of allergens, most commonly plant, pollen, fungi, animal allergens, and dust mites. So one type of rhinitis is allergic rhinitis, otherwise we can call it as hay fever. It is mainly occurring when there is a hypersensitivity reaction. Hypersensitivity reaction means first year you studied. It's a kind of allergic reaction of a large group of allergens. A lot of allergens present in our environment, mainly plant pollen, the pollen or dust you can see on the flower, the fungus, animal allergens or dust or mite from the animals and dust mites. Okay, affects 20 percentage of population. Ig mediated immediate hypersensitivity. Okay, so this is all about the introduction. Let us move to the definition. It is an inflammation of the nasal mucosa. And another one is rhinitis is a group of disorder characterized by inflammation and irritation of the mucous membrane of the nose. Okay, so this is the definition. It is simple. It's inflammation and irritation of the mucous membrane lining the nose. Let us see the classification. First one is acute rhinitis. In that, non-allergic is there. Under the non-allergic, infective rhinitis is there. Mainly, it is occurring due to viral. We can call it as common cold. Rhinitis associated with influenza or other viral infection. Then second one is bacteria usually occurs as a secondary infection following unresolved viral rhinitis. So the bacterial rhinitis is mainly occurring because of a secondary infection. The next one is non-infective. Vasomotor rhinitis and rhinitis due to chemical irritation. When you are exposed to chemical irritation, vasomotor rhinitis means when there is a change is happening on the pressure, mainly on the blood vessels, or if some changes happening due to stress, that can lead to rhinitis. And another cause is rhinitis due to chemical irritation. Second one is allergic or hay fever. Mainly here in the description they have mentioned that rhinitis mainly nose inflammation, nasal inflammation. You can see in the picture. Allergic rhinitis also known as AKA means also known as hay fever caused by allergens, and they have mentioned hay. Hay. Do you understand what is hay? So it is a grass you can see in the rice field. Okay, or a gas. Okay, that is called hay. Then pollen, dust, animal hair, mold spores. Okay. The next is a chronic rhinitis. Okay, it is in that a non-allergic is there. That non-specific chronic catarrhal rhinitis, chronic hypertrophic rhinitis, chronic atrophic rhinitis, then rhinitis medicamentosa. That means it is drug-induced rhinitis. Then specific under that scleroma. It is a kind of thick patchy formation of the tissues. It is a rare type of rhinitis. Mainly you can see in syphilis, tuberculosis, lupus, and leprosy people. Okay. Then allergic perennial allergic rhinitis. So these are the classification of rhinitis. So I don't think you need a explanation for this one because it is not that much important. You just write down what are the classifications. Then next we will see the causes. In that first one is rhinovirus. Okay, it's a kind of virus which present in our environment. Then second one, droplet infection. Any kind of droplet infection can lead to rhinitis. Then reaction of body's immune system to an environmental trigger. The most common environmental triggers include dust, molds, pollens, grasses, trees, and animals. Both seasonal allergies and year-round allergies can cause allergic rhinitis. So seasonal allergy and year-round allergy means it is nothing. Seasonal allergy means on the particular time it is occurring. For example, some kind of flower, or even if we are talking about dust, dust is mainly forming during the summer time, okay, or in the hot weather, because in winter time or in monsoon, because of the moisture, dust will not produce that much. So we can call dust is a seasonal. Then year round allergy means always present in the environment, okay, some kind of thing had like humidity, temperature, then heat, okay, moisture, this all are always present in the environment, that we can call as year round allergens. So these are the main causes which can lead to rhinitis. Then some of the thing we can see, changes in temperature, humidity, that is also a cause. Then use of over-the-counter and prescribed nasal decongestants. So some of the over-the-counter medicine means which the medicine which we are directly buy from the medical shop without prescription. Okay, so sometimes when we are having fever or having some pain, we are usually we are going direct to the pharmacist, and we are getting medication without prescription, that we can call as over the counter medication. Then foreign bodies, okay, some of foreign bodies coming in contact with your nose. Then allergic rhinitis may occur with exposure to allergens such as foods, example peanut, walnut, brazil nuts, wheat, shellfish means that sea fish, okay, sea fish, especially that the shell will, which having shells will be there. So that for example prawn, okay. Then soya, then cow's milk and eggs. So these are the certain foods can lead to allergic rhinitis, okay. Not it will not be seen in everyone, but some people are allergic. Then medication, certain medication like penicillin, sulfa medication, which the medicine which contain sulfate, and aspirin can lead to rhinitis. The most common cause of non-allergic rhinitis is the common cold. Drug-induced rhinitis may occur with antihypertensive agents such as ACE inhibitor, that is angiotensin converting enzyme inhibitor, and beta blockers, statins, antidepressants, aspirin, anti-anxiety medication. So these are some of the medication which can lead to drug-induced rhinitis. So that we have seen previously in the type classification. So during the use of this kind of medication can lead to allergy. Let us see another some more causes, that are dust mite, feces, dog dander, cat dander, then cockroach droppings. Okay, cockroach droppings means while cockroach is moving, that time some kind of waste material will be remaining, so that can lead to allergy. Then cat and dog dander means that dead skin which is present in their body. Then dust mite, feces. Okay, so these are certain causes which can lead to rhinitis. Let us see the pathophysiology. So pathophysiology is very simple. Here they have explained little more. No need to confuse. I will explain it. The tendency to develop allergy or Ig mediated reaction to extensive allergens has a genetic component. So we are in the gene itself. We are having a component which always tend to develop allergy. Okay, that is called immunoglobulins. Okay, that is present in our body. When it is react to the external allergens, there will be a allergy, okay. In susceptible individuals, exposure to certain foreign protein leads to allergic sensitization, which is characterized by the production of specific IgE directed against this protein. So in some conditions, susceptible individual means those who are having allergic attacks, okay. In some conditions, what is happening, exposure to certain foreign protein means that what all things we have discussed, the causes, okay. It may be dust, pollen, whatever it is, the which is characterized by the production of specific Ig directed against this body. So when we are exposing with, or the susceptible is exposed with some kind of foreign bodies, in our body or in their body, there is a specific Ig, immunoglobulin E will be produced in their body, okay, that forming a protein. This specific Ig coats the surface of the mast cell which are present in the nasal mucosa. And what is happening means, once we are exposing that time, this specific Ig is forming in our body and it will present in the nasal mucosa. When the specific protein is inhaled into the nose, so here's a specific protein means that is a foreign body, either it is dust or pollen or some types. So once we are exposing that in our body, Ig will be forming, specific Ig will be forming, that will be react against that specific. For example, for dust, particular Ig will be forming, or a specific Ig will be there. For pollen, specific Ig will be there. So this will be always present in our nasal mucosa, and whenever we are coming in contact with this kind of foreign body like dust or dander or pollen, it can bind to the Ig on the mast cell, leading to immediate and delayed release of a number of mediators. So we know that in our body, when our body is coming in contact with some foreign bodies or some allergens, suddenly inflammatory reaction will be produced, and that only they have mentioned here. When the specific protein is inhaled into the nose, or once it is entered into the nose, it can bind to the Ig on the mast cell. So we have discussed that already Ig is present in our mast cell in the nasal mucosa. So once a foreign body is coming in contact or entering into the nose, that time this mast cells or this foreign body is covered with the mast cell, leading to immediate and delayed release of a number of mediators, so that there is a chemical mediator release will be occurring. The mediators that are immediately released include histamine, tryptase, kinase, kinins, and heparin. These are the chemical mediators. Okay, so these chemical mediators are as a part of inflammation. These are the chemical mediators which are releasing. The mast cell quickly synthesize other mediators, including leukotrienes and prostaglandin D2. So once the mediators are releasing into the nasal mucosa, some more mediators will be synthesized by the mast cell. This mediators why various interactions ultimately lead to the symptoms of rhinorrhea. So due to the reaction of the chemical mediators which is produced by the mast cell and already released from the your nasal mucosa, both of things will react together and it will form some kind of symptoms that including rhinorrhea. We have discussed, that is nasal discharge, the nasal congestion, sneezing, itching, redness, tearing, swelling, ear pressure, postnasal drip. So these are the common signs you can see in once you are exposed with a chemical or with a foreign body or with a allergen. Okay, so how it is occurring? Once you are once you are exposed with the allergen, Ig will be forming some chemical mediators, and due to the reaction of the chemical mediators, this kind of symptoms will be forming. Then what can we see? Mucus glands are stimulated, leading to increased secretion. Vascular permeability is increased, leading to plasma exudation. So it's a kind of normal defense mechanism or normal function of the nasal mucosa, that if some foreign body is coming or allergen is coming in contact with the nasal mucosa, it should be drain outside, or it is to be flush outside. Okay, the nasal mucosa will not allow it to enter into the respiratory tract. So as a part of this reaction, what is happening? Mucus gland will stimulate, leading to increased secretion. So once the mucus gland is stimulate, more secretions or more mucus will be producing, and that can lead to plasma exudation. Then vasodilation occurs, leading to congestion and pressure. Sensory nerves are stimulated, leading to sneezing and itching. So all kind of defense mechanism will be starting. So the person will start sneezing and itching. So while doing sneezing and itching, the foreign body or the allergen will come outside. All of these events can occur in minutes. Hence, this reaction is called the early or immediate phase of reaction. So, this all things are happening within time, okay, within minute. Okay, once we are exposed, for example, once we are exposed with some dust or pollution or some kind of dander, suddenly there is a change happening on your nasal mucosa. You will start itching, then we are start sneezing. Then during sneezing and itching, the plasma will be flushed out, or it will comes out, and the allergen will move out or drain from your nose. So this particular phase we can call it as immediate, early or immediate phase of reaction. Next, over 4 to 8 hours, this mediates through a complex interplay of events lead to the recruitment of other inflammatory cells to the mucosa, such as neutrophil, eosinophil, lymphocyte, and macrophage. So sometimes after this immediate or early reaction, also this mediators will be remaining in the nose, and it will play complex. Complex means togetherly they are playing some more role that can lead to recruitment of other inflammatory cells. So in our body, inflammatory cells are there, that are WBC cells. This result in continued inflammation termed the late phase response. So once we are exposing with the allergen, that time we are having the reaction, and afterwards, if some of the allergen is remaining in our nose or in the nasal tract, after 4 to 6, 8 hours, again the reaction will happen. The symptoms of late phase response are similar to those of early phase, but less sneezing and itching and more congestion and mucus production tend to occur. The late phase may persist for hours or days. So this can happen in some people after the early or immediate reaction. Again, if the allergen is present in the nose, then after 4 to 8 hours, one second reaction will be occurring, and but it is less, it is similar to first reaction, but less sneezing and itching. That much sneezing and itching will not be there, but more congestion and mucus production will be there. Okay, so this all about the pathophysiology. I hope you understood. Then next we will see the clinical features. In that, mainly three stages are described in clinical features. Stage of invasion, that is happening within some time or few hours. Sneezing, burning sensation of the nasopharynx, nasal obstruction, headache, pruritus of nose. So these are the signs you can see during the entry of the allergen or stage of invasion. Second is stage of secretion, that happening within days. Low grade fever, malaise, arthralgia. Arthralgia means muscle pain, nasal obstruction, and profuse watery rhinorrhea. So this you can see in secretory stage or within few days. Then next one, stage of resolution. Resolution means it is settled down. Okay, resolution within 5 to 7 days is the natural course of an uncomplicated disease. So that is a natural phenomenon of our body. If it is not a complicated disease, then normally it is resolved. Symptoms lasting beyond 7 days or worsening instead of improving suggests that secondary bacterial infection is being established. Okay, if it is symptoms are last beyond 7 days, if it is more than, if you are having the itching or sneezing or the allergic signs and symptoms more than 7 days, or if it is worsening, then we can call it as some secondary bacterial infection is started. Okay, so these are the signs of symptoms. Next, we will see how to diagnose. That first one is history collection. Collect the history about the person, past, present, and any allergic history, occupational history, living conditions. Then physical examination should be done. Okay, any kind of obstruction or foreign body presence. Then allergic diagnostics, in that skin prick test is there. Then blood test for allergy, that is total Ig and specific Ig we can identify. Then nasal allergen challenge test. So these are the allergic diagnostic tests we are doing for rhinitis. So in the total Ig, rarely helpful as 50% patient have Ig level within normal range. Okay. Then specific Ig in that allergosorbent test, RAST, radio allergosorbent test, and modified radio allergosorbent test. So these are the two tests blood tests we are doing for identify the allergies. Okay. Then next is nasal endoscopy. It is a imaging technique. So we are inserting a probe into the nasal tract, and we are identifying about the structure of the nose. So here you can see the picture, and the right side you can see CT scan, nose and peripheral nerve system. Okay. So these are the diagnostics tests we are doing for rhinitis. Next we are moving to the treatment. That first one, supportive treatment, it including bed rest, analgesics, nasal decongestants, it including drops and systemic, and occasional steam inhalation. So these are certain non-pharmacological management we are doing for rhinitis. Okay, proper bed rest we have to provide. We have to avoid the exposure to dust or allergens. Then we can give allergens, analgesics if they are having severe headache or nose pain. Then nasal decongestants in order to prevent the decongestion or obstruction. So it will ease the breathe or it will help for improving breathing. Then steam inhalation also help to prevent the decongestion. The next one is antibiotic. Administration of antibiotic should be reserved for treatment of secondary bacterial infection. If there is a underlying bacterial infection or secondary cause is there, then we have to provide antibiotics. Okay. Then we can see the symptomatic relief. For the symptomatic relief, we can give antihistamines, corticosteroid nasal sprays. Antihistamines, one example is cetirizine. Then corticosteroid nasal sprays are available like Otrivin. Then bromophenramine, pseudoephedrine. These are certain examples. Then for a combination of antihistamine and decongestants. Then cromolyn or nasal chrome. Okay, a mast cell stabilizer that inhibits the release of histamine and other chemicals is also used in treatment of rhinitis. Cromolyn usually coming in nasal drop form. We can call it as nasal chrome. So it is a mast cell stabilizer. Okay, we have studied that there is a protein coverage will be occurring or a protein will be attaching to the mast cell in the uh, nasal mucosa. So here it is a mast cell stabilizer that inhibit the release of histamine. So due to the mast cell presence in the nasal mucosa, the chemical mediators are releasing. So in this, this medicine will helps to inhibit or stop the release of chemical mediators. So the people will not feel any kind of running nose, itching, and sneezing. It is a symptomatic treatment. Then you can see the use of saline nasal spray can act as a mild decongestion and can liquefy mucus to prevent crusting. Saline nasal spray are available in the pharmacy. It will help. It will act as a mild decongestion. It will helps to relieve the congestion and also liquefy mucus to prevent crusting. Two inhalations of intranasal ipratropium. It's an example of intranasal spray. Example that is name is atroven or ipratropium can be administered in each nostril 2 to 3 times per day for symptomatic relief of rhinorrhea. If the still we have seen that in the clinical manifestation, it can be remain to 5 to 8 days. Okay, so or, beyond or more than 7 days. So in that conditions, we can provide intranasal ipratropium or atroven. It will helps to relieve from rhinorrhea and other possible symptoms. Then intranasal corticosteroids may be used for severe congestion and ophthalmic agents may be used to relieve irritation, itching, and redness of the eyes. Newer allergy treatment include leukotriene modifiers, montelukast, safirlukast, and ciliotin or Cyflo. So these are the medicine which is available in the pharmacy or in the hospital. They are called as leukotriene modifiers. It's a newer allergy treatment. It will help to relieve from rhinitis. So this all about the topic rhinitis. It's a small topic. You just go through properly. You have to read everything properly, make the notes, and one assignment is there. That is, you have to make the nursing management for rhinitis. What are the nursing management, including health education? It should be complete. It's a part of your learning activity. So take it as an assignment, and you have to finish it. Go through the topic. I think you are. I hope you all understood about the topic. If any doubt, you can ask me. Okay, thank you. Have a nice day.